Hi, my name is Tara. My husband's military, and this is kind of a blog to tell people and fellow military spouses the whole thing with Tricare and IVF. First, let me say that this is how it works for a male and female couple. I'm not sure how it works for same-sex couples. It could be a different process, it could be the same, and a little bit different. So the first thing you need to know is, does Tricare cover IVF? It depends. If you use one of the 5 military hospitals that actually do IVF, it will cover all but about $4,000. And that's the part that the infertility clinic off base takes care of. If you go to a civilian doctor, it won't cover anything except maybe the blood work and medication that you can pick up on the base. So that being said, the first thing you have to do is look up which hospital and decide if it's convenient for you to go to these. You have Wilford Hall, which is on Lackland Air Force Base. You have Triple Army Medical Center in Honolulu. There's Walter Reed National Medical Center in Maryland. San Diego Medical Center, obviously in California. And Madigan Army Center in Tacoma, Washington. So you have to find out if any of those are a good fit for you. And remember, whatever branch of the service you are in, you can get referred to a military installation. So that's your first option. My husband and I are in California, so we decided to go through the Navy Medical Center in San Diego. And I can tell you that at this point, the doctors have been fabulous. I've loved them so far. Now, the next thing you need to know is each place has their own guidelines on if you can do IVF. Weight, BMI, height, age, if you already have biological children, all factor into that. My husband and I have been married about 5 years. I have 2 children of my own. He has one of his own, so we didn't have any biological children together. And given the fact that when we got on the wait list, I was 32, not quite 32, we had no problem going on the list. The second thing you need to know is there's going to be a wait. Since the military is covering the majority of this cost, if you do it through one of these facilities, you're going to have at least a year wait. We've been on the wait list since March of 2014, and we go later today for our final baseline ultrasound, and we start our injections, and our retrieval and implantation is in about 2 weeks. So then, obviously, you have to make an appointment with your primary care physician, and you're going to get a referral to whichever base works best for you. Once the referral goes in, it takes about 3 to 5 days, up to about 3 weeks. You'll get a letter in the mail telling you that the referral is in the computer, and you can call to the facility and ask and make an appointment. So, your initial appointment is you're going to meet with your docs. If you end up in the Navy Center down in San Diego, remember it's a training hospital, and most of these are. So you're going to have a lot of nurses and a lot of doctors who are new and learning. And anytime you have a procedure done, you're going to have a full house. So once you get down there, you're going to discuss your options. You're going to have a physical, and you're going to make sure that you meet the requirements. As long as all that works and you test out healthy and your blood pressure and everything is good, there should be no reason why you can't go on the wait list. On that note, you will discuss, in my case, I had a laparoscopic tubal ligation about 12 years ago. So that's why we are going IVF route. Now, Tricare would have paid for me to get my tubes untied as long as I did it at one of those 5 medical centers, and I could have done it in San Diego, but we already have built-in birth control, so I wasn't trying to actually have any more than the one-time go. So we went with IVF. And my next question was, as soon as the doctor said we were great candidates for IVF, was, can I pick the sex of the baby? The answer is yes, you can, but it's an extra $10,000 to $15,000 on top of what you're already paying. So in our case, with me being a school teacher and him military, we decided that we would just get what we get. The next thing you need to know is there is a very high risk of twins. You run about 25% chance of having identical twins, and you actually run about a 50% chance of getting multiple births, which is fraternal twins, because they do implant more than one embryo, and depending upon your age and your health and everything, you have upwards of a 75% chance of it taking the first time. And the doctors are pretty confident that it will work, especially if you're around my age and my height and body weight and everything. And if you've had healthy pregnancies before, there should be no reason that it wouldn't. Alright, so then the next thing you do is, after you discuss your options, you go on the wait list. And like I said, we went on the wait list in March of last year, and I didn't realize it was such a long process once you get to the top of the list. It's not, oh, you're at the top of the list, here, let's go do this. There's a really in-depth amount of stuff that you have to do. So in March of 2015, I got the calendar and we got our dates and picked everything out with the IVF coordinator that works at San Diego, and she coordinates out to the IVF clinic in San Diego, and they send you a calendar and tell you everything that you have to do. So starting in March, you go on prenatal vitamins, and as counterproductive as it sounds, you go on birth control. My exact thought was, isn't that counterproductive? I'm trying to get pregnant, not keep from being pregnant. But it's all about the hormones, and birth control holds your ovaries because they don't want you to destroy or lose any more eggs than you already have. Because remember, you're born with the amount of eggs that you're going to have the rest of your life. So as you have a period and you don't get pregnant, you're losing those eggs. So the birth control is really to hold it, to make sure you don't lose any more eggs. And you're going to take that continuously. You're not even going to do the placebo pills. In my case, I was on Yaz, and you have those white pills for 7 days, but you didn't do that. You just started a new pack. And we went off those on the 10th of this month. So while you're preparing for IVF, and as soon as you go on the list, you need to start doing your walking and your yoga and all this stuff that you're going to do while you're pregnant, because you can't start a new exercise regimen once you get pregnant. So it's easier to do it and, you know, get healthy and get ready for being pregnant, because if you haven't had a baby, or if you have before, pregnancy is hard on your body. And the older you are, the tougher it is. I had my kids when I was in my teens and my 20s, 18 and 20, and it was hard. I can't imagine going the way I did when I was pregnant and had a 2-year-old at this time of my life. So then about 4 months out, when you start the birth control and the vitamins, you and your spouse are going to go and get an insane amount of blood work done. That'll test for things that you've really never heard of. My husband had to have about 6 vials of blood taken, and I literally had 12 vials. The guy who was taking the blood draw said he had never taken so many vials or seen so many tests, and he had been there about 4 months, so he had never seen the IVF blood work paperwork. So they're going to test you for the standard HIV, HPV 1 and 2, the herpes simplex 1, herpes simplex 2, and then they go on and they test the ladies for the hormone that makes you produce milk. They test you for the hormone that keeps you pregnant, which is progesterone. They test for a whole lot of stuff. Alright. Got a list. Alright, so then about 3 months out, the person carrying the baby will schedule an appointment to get a ultrasound, and it's an internal ultrasound, but it's a fluid injection. So what they're going to do is they're going to put a catheter into your uterus and then blow it up with water so that they can get a good look at it. And as long as everything looks good, there's no scar tissue, no polyps or anything like that, you're good to go. But if they do find something, which in my case they did, you have to go in and they'll put you to sleep and they schedule you for a histocoloscopy. And they go in and they look at what they saw and they get a better idea. And if it was just fluff or something from your menstrual cycle, then they just take the camera right back out. But if it was something, they'll go ahead and they burn that off, because the thought behind that being is if there's anything that can cause a problem with being pregnant, they don't want to take that risk. So they want to go ahead and just take that out. And remember, TRICARE pays for all of this, so it's better to do it. That way you have a healthy pregnancy than to not do it and possibly miscarry. Alright, so once all of that's done, and in my case, I had that done in June of this year, 2015, and everything went good, and they removed what little bit of polyp it was. It was right by my fallopian tube and took it out. So we're good there. Now, once you receive your IVF calendar, you're going to get this huge amount of paperwork that you and your husband have to go through, and you have to fill it all out, and you have to sign in, and you have to take it with you to every appointment after that. And it's things like explaining the procedure. It talks about what you're going to do with your embryos, if there are any left over, in case of a divorce, in case of the death of a spouse, in case of the death of both of you. It also talks about chances of having a multiple birth. It talks about, not all embryos are going to be viable, all of that stuff. And it's a good read, and you have to take it with you every time you go. Alright. Now, you have to go back if you end up having to have, the internal surgery, you have to go back for a post-op, and at the post-op, they'll tell you what they did, and they'll explain everything they did. In my case, they told me that I had, a minor polyp. They didn't even have to burn it. They just pulled it off and woke me up, and I was fine. They were in there all of about 20 minutes, and they didn't even have to put me completely to sleep. Now, the last thing that you have to do, you have 2 more appointments before you really get into everything. You have to go to an injection class. Your injection class is basically with the infertility clinic, and they're going to tell you how to do your injections, and there's no way around it. You're going to be taking 3 injections a day. 1 is progesterone, and that's the hormone that keeps you pregnant. You're going to actually start that when you start your hormone injections to develop more eggs. Then you're going to be taking a dermis injection twice a day, and you're going to be taking a subdermis injection. So dermis means it's just a little tiny needle that just goes right under the skin. No big deal. Subdermis means it goes into your muscle. It's going to go all the way through your skin and into your muscle. So it's like one of those deep shots, like the tetanus shot. That's exactly what it feels like. But all of these shots are going to be done in your stomach, in your lower abdomen. So that's something you have to really be prepared for. And trust me, don't look up YouTube videos on how to take those shots, because it scared me. I'm not a big fan of needles, but in this point in my life, there's not really an option. So, the next thing you have to do is schedule your baseline ultrasound. My baseline ultrasound is today, and they go in and they look and they see where your ovaries are, how everything looks, and then they give you what your dose of medication is going to be, and you have to pick your medication up while you're there. The good news is, if you're in San Diego or one of the other medical facilities, you can go right downstairs, get your medicine, and go home. I would suggest, if you're traveling for this, to try and schedule as many things in a day as you can, instead of having to go back down countless times. So after we start our injections, which will be today, we have to go back on Monday to get blood work done. And depending upon the blood work, I may have to have another ultrasound on the 18th. If not, then they will tell us what date. It'll be sometime between the 24th and the 26th that they're going to do the retrieval, and then 3 to 5 days later they'll do the implantation. The thing you need to remember is this is all kind of built upon your cycle. So you have to really know your body. In my case, I know I get my period every month on the 10th, and I know it's over on the 14th. So that means every month I'm fertile sometime around the 24th, because we know it's 12 to 14 days after your period. So if you know your body and you know your cycle and you're pretty regular, you shouldn't have a problem. Not that it really matters, because they are going to kind of change your cycle, especially with birth control and the injections. It kind of stops everything, does what they want, it makes your body do what they want it to do. But it does help if you plan everything around your schedule, and I just did it that way. So this is going to end my first video, and after that we will be posting later to see how everything goes, and hopefully this was a little bit of information that I know some of my military family out there somewhere wants to know, and how to go about the process. And if you want to email me, feel free. My email will be at the bottom, and I'm more than happy to talk with you, tell you what's going on with us, answer some questions. That's fine. Thank you.